Hi Mr. Lim. Long time no see. How can I help you today?
Hi Fatin. I just came here to get something first before I try doctor lah.
Oh, are you sick?
Yeah.
No worries. Let's have a look first.
Hey, I've tried many creams but I still can't get rid of this Really fed up Thinking of getting a consultation, but then I'm worried about the queue.
Oh, don't worry Mr. Lim. We are actually now working together with doctors virtually to address your needs. You can even consult a doctor here. Let me show you how.
Oh, you can try doctor?
Yes, so if you can see here, we have a list of doctors with various expertise to help with our customers' condition. For your condition, let's talk to Dr. Mala. She's an expert in this field. Caring Pharmacy is proud to introduce Cherry Doctor Service, our new initiative to help you to consult with doctors directly for your health concerns at our stores. With Cherry Doctor, you can now conveniently consult your preferred doctor at any Caring Pharmacy stores. Working together with the doctor, Caring Pharmacies are here to provide one-stop solutions to your medical needs. Okay, Mr. Lim, here are all your medications.
Thanks a lot, Fatin. This service is so easy and convenient.
Thank you, Mr. Lim. Have a nice day. Cherry Doctor, convenience for your medical needs.
Meet Uncle Sam, a 45-year-old man who experiences fatigue and feels unwell constantly, impacting his performance in work and family life. These conditions happen due to cholestasis and chronic liver disease. Fortunately, there is a treatment, which is Heptrol 500 mg gastro-resistant tablets. Heptrol contains S-adenosyl L-methionine. It functions as a coenzyme and is involved in our body's essential metabolic processes for healthy cell layers. Heptrol is also involved in the formation of glutathione that helps in liver detoxification. Heptrol is able to support liver health and relieve fatigue caused by chronic liver disease. Heptrol is safe and well tolerated with more than 20 years of liver care experience. Want to know more? It's available in all leading pharmacies, clinics, and hospitals. Check it out with your healthcare professional to find out more. This is a medicine product advertisement.
Hi, good evening, everyone. Thank you for tuning in tonight to our live stream. All right. So I'm Shun Ern, your caring pharmacist and your host for today's live stream. I hope everyone is in good shape today. All right. How are you, everyone? I see a lot of you is commenting and is very excited for today's live stream. Right. So hi, I see. Hi, Emily. Good evening. Fiona, Jaslyn. All right. Kitty. Good evening, everyone. Everyone is excited for this today live stream. So everyone is good. Okay, so tonight our topic will be around liver health. All right, this is a very important organ which is responsible for over 500 vital body functions, and we will also be discussing about fatty liver disease. all right? And we will let you know how that we can prevent it, all right? So if you or anyone you know is concerning about their liver health and want to know more and learn more about fatty liver disease, tag them and share this link of this live stream tonight to them, so that ask them to join us tonight. All right, we will be having a very expert guest in our live stream. He is a consultant and gastroenterologist who has extensive research and very long working experience in this field, and and he will let you know all about fatty liver disease and how we can take care of ourselves and our liver health. All right, and also don't forget that we will also be having giveaway, very exciting giveaway for 3 lucky winners during this live stream. All right, so stay with us throughout the live stream. Tag your friends and family to join us to win the lucky, to be one of our lucky winners. All right. So without further ado, let us welcome our guest of the day, Dr. Weng Kai.
Good evening, everybody. Thank you very much, Shun Ern, for the nice.
Good evening, Dr. Chan.
Hi.
Hi, Doctor. Good evening. It is our pleasure of having you here. How have you been doing lately?
I've been okay. I mean, it's getting a bit busier, but again, everybody's preparing for Chinese New Year, one celebration after one celebration. Everybody's having a good time.
It's having a lot of festive season in December and January, right? Happy
Yes, it is. Yes,
New
indeed.
Year, like Chinese New Year, Christmas, everything is coming. Yeah. So I think some of the audiences here are still not so sure what doctor as a gastroenterologist does every day. So do you mind sharing with us a little bit of your day-to-day tasks?
Sure. So I'm a physician as well as a gastroenterologist. So I look after patients with a multitude of medical conditions, with a specialty of mine in gastroenterology and liver diseases. A bulk of my work will look after or involve patients with stomach, intestinal conditions, and we do endoscopies or scopes for the stomach as well as the large intestine, and even for the bile duct and pancreatic problems as well. And another part of it will be managing the medical issues such as fatty liver diseases, viral liver diseases, and a multitude of other medical problems, including diabetes, hypertension, the works.
Yeah.
So most of the time, we because I work in a large tertiary hospital, we would be managing inpatients, patients who have ill enough to be admitted to the general wards, as well as patients who are seen at the clinic, and both patients would actually be admitted for procedures, especially for endoscopic procedures, and even certain conditions such as more advanced liver diseases, which may need biopsies or further inpatient care. So, it's a good balance of inpatient and outpatient. So definitely enough to keep me on my toes every day.
Yeah, seems like Dr. Chan has handled a lot of cases of like throughout a lot of field, like gastroenterologists, your hypertension, diabetes, all kind of related to the liver health as well. All right. So I think Dr. Chan is a very good source. I mean, to let us know more about fatty liver and also how to take care of liver health. All right. So yeah. So everyone, before we proceed into our topic tonight, so be sure to stay tuned with us until the end of this live stream, because we will be having a giveaway for 3 lucky winners who answer the most accurately to our question later, that I will ask to you all later, to stand a chance to win a Caring Cash voucher worth 50 ringgit each. All right, 50 ringgit can get a lot of things in Caring pharmacies. All right, so call up your friends, tag your friends and family to join us now. All right, okay. So, all right. So hi, hi Lila, hi Miss Tan, hi Lok, hi everyone. So
welcome.
Right, so come over here to join us this live stream and tag your friends and family. All right. So let's start our topic today, Doctor.
Sure.
So our topic today, as I said just now, is about fatty liver disease. So Dr. Chance, how about we start off for some basic about liver health and also fatty liver disease?
Sure. So maybe I have the first slide. So essentially, for most of us, what is fatty liver disease? As the name actually mentions, it is actually a lot of fat accumulation in the liver, or what we call as excess accumulation of fat in the liver. So generally, we can just divide it into fatty disease due to alcohol, and on the other arm, fatty disease which is not due to alcohol, which is what we term as non-alcoholic liver diseases. So for decades and even more than a century, we used to actually divide the fatty liver disease into this alcoholic and non-alcoholic. But since 2020, we have sort of found out that actually, it is all due to a big metabolic issue where a lot of interplay between metabolic illnesses leading to this fatty liver disease. And in 2020, we actually have changed the name slightly to this metabolic syndrome associated fatty liver disease. Again, the disease itself is the same, but it's just slight name change. So the most important thing that we need to know or we need to understand is that there is actually a lot of fat accumulation inside the liver and not what some people term as fat surrounding the liver or outside the liver, but this is actually fat cells inside the liver, which is swollen and causing problems.
All right. So as Doctor mentioned just now, the fatty liver disease usually related a lot to our metabolic syndrome such as diabetes, hypertension, right? I think just now Doctor also saying that you always handle these kind of cases, right? But how does fatty liver actually look like, and how does it affect our daily life and our health?
Okay, so as I said, the fat is not outside the liver, but it's actually inside the liver. May I show you this slide? So on the top left, you would see a nice healthy liver, which is usually dark red or even pink. And if we were to put in a small needle to take a little bit of tissue to send to the lab, it would look very nice where there's quite an even pattern of normal liver cells. We will contrast it to the bottom left where it is actually a fatty liver picture where you can see the liver is almost yellow compared to a nice pink or maroon colored liver. And if you were to take a tissue to actually put it under a microscope, you can see all these bubbles of fat, which is very, very abnormal compared to the biopsy, normal tissue biopsy on the top. And this is where we tell the patients that they have this condition called fatty liver. If we move on. So again, some of us will say, hey, how does it look like outside our body? We only see pictures. Some of us may enjoy this delicacy called pate, which is actually goose liver, where in the process, the goose are actually overfed or fed a very high calorie and fatty diet. And as a result, the liver actually balloons to many times its normal size. And once harvested, the whole liver is yellow and actually very, very fatty. But of course, when it's cooked, it's a different story. It tastes very, very nice. But of course,
it's very expensive as well.
Very expensive. It is a delicacy. But of course, you can see that this is actually how our human fatty liver would look like in very severe case. So, this is something that we do not see from the inside, but example is what we see as this duck liver, which is a common gourmet dish called pate. So this is how it looks like actually.
Okay, all right. Thank you, doctor, for the explanation. But you show us a microscopic photo just now, it's kind of concerning when we get a fatty liver, because you said the fats is actually all cover up our old cells, then whole cells, then the cells cannot function properly as our liver. And liver is very important for our body functions since it's responsible for so many body functions in our body, right?
Definitely.
Yeah. So, Doctor, just like you mentioned about the changes of the term in fatty liver. So, but when did this term of fatty liver first appear?
Okay, so, of course, scientists have been looking at a lot of these patients, probably patients who have passed away, and they have actually looked into the inner organs. And in 1845, they actually have already noted that there was some patients who actually died with a lot of fat in the liver. So in 1845, the term of fatty liver was first used. And over the years, into the 20th century, in 1980, they actually coined this term of non-alcoholic fatty liver disease, and in another more severe spectrum of non-alcoholic steatohepatitis, where it's actually active inflammation in 1980s. And over time, all of us, we have been studying and we've been looking into this disease, defining it into alcoholic, non-alcoholic fatty liver disease, until in 2020, when we have seen so much interplay between metabolic problems related to this fatty liver disease, and we have slowly changed the name to metabolic syndrome associated fatty liver disease. So slowly but surely, we're actually moving away from this NAFLD or non-alcoholic fatty liver disease to this MEFL or metabolic syndrome associated fatty liver disease. But not to worry, both are actually meaning the same things. And for the interest of our talk today, we're actually going to talk about non-alcoholic fatty liver disease. So you'll be sure that, these problems, it is not new. It's not in something happening in the 20th century or the 21st century, but it has been there since 1845. Historical, actually. It's historical.
All right. So for today, like just now, Doctor mentioned about non-alcoholic fatty liver disease, or in short, NAFLD. So, what is the progression like? So, and also a lot of people is actually quite interesting and asking if someone has NAFLD, is it reversible, Doctor?
Right. So actually, like all diseases, there is a spectrum of the progression of the disease. May you show the next slide? So on the far left, we will actually see a healthy liver, which all of us are usually born with. And in this diagram, we can actually see some blue arrows and some red arrows. Okay, these are the small blue arrows and the small red arrows. The blue arrows would actually show some reversible component, meaning that if intervention is done, there may be some resolution or reversible component of the injury. But in certain later stages, in the red arrows, these are usually hardly reversible, and in severe cases, may need even liver or organ transplantation. So generally from a healthy liver over time, due to all these factors of poor diet, lack of exercise, a very elevated weight, or even excess consumption of calories and fatty foods, they can become this condition called non-alcoholic fatty liver disease, NAFLD, or fatty liver for short. And for some reason, there will be some oxidative stress, which actually causes the liver to go into this condition of inflammation called NASH, or non-alcoholic steatohepatitis. So in some patients, it is still reversible, even though there is some early damage or scarring called fibrosis. But in patients with very advanced or severe fibrosis, where the liver is all shrunken and cirrhosed, it is no longer reversible. So there will be a time where some patients would have missed the boat. And no matter what they do, a hardened, cirrhosed, shrunken liver cannot reverse. And these are the patients, over time, they would progress to liver cancer, with or without cirrhosis. But generally, once there's excessive scarring in the liver, not very much can be done to actually reverse the damage. So it's very important for us to, one, find out that, okay, we have fatty liver. Two, we are not having any severe inflammation or damage. And hopefully with interventions, we can reverse it, hopefully to almost a normal liver. If not, at least we will try to halt the damage of the liver.
All right. So thank you, Doctor, for the explanation. So it's very important for us to detect it earlier, right?
Correct. Early, especially when we detect it early, if there is no fibrosis or what we call as early scarring in the liver, definitely with proper intervention, the liver can still be saved. But of course, this needs a hand-in-hand approach with the patient, and the patient has to work hard to actually reverse this damage. So here in the next slide, again, we reiterate how the natural history of this non-alcoholic fatty liver disease comes. So again, from a normal healthy liver, there's a problem where there's actually excess fat into the liver, causing this steatosis, or what we call as steatohepatitis, leading to a lot of inflammation and ultimately early liver damage or damage causing fibrosis. As the liver is damaged further, the liver is scarred irreversibly, which is a condition called cirrhosis. And over time, the liver will fail. And without a doubt, in years to come, liver cancer will come by in a cirrhotic liver. And of course, all this damage to the liver, we would actually see some increase in what we call as liver enzymes, the AST, ALT, the bilirubin, gamma GT, as well as alkaline phosphatase, or in short ALP. And these are some of the markers which we will routinely see when we do routine blood tests, which can be done in a lot of our labs outside, or when you actually come and see your doctor in the clinic. So definitely this is how it slowly progresses, and when there's progression, definitely we will pick up some abnormalities in some routine blood tests.
So in short, we have to like do our blood test and also
Right.
detect it earlier. So Fiona and Steve, I think, yeah, doctor has answered. You all need to detect it earlier. Everything detect earlier, there is a chance of it's reversible before it really go into cirrhosis level, right?
Yes,
So
definitely.
doctor, so to test it earlier, other than to test it earlier, what are the symptoms that our audience can look out for NAFLD?
Okay, so generally, in a very early stage, many of us will not even know that we have NAFLD, all right? But of course, in certain patients, we will look up, especially patients who have a very high body weight or obesity. And some of these patients, without a doubt, they would actually have some lethargy. They would actually not be very, very active in their activities most of the time. And if we were to actually test certain tests, like blood tests or even ultrasound levels, we would pick it up. So most of the time, without testing, many people will not know that they have fatty liver disease, and it is often found as an incidental finding during routine screening, which a lot of people, even the younger groups, are coming by to actually do routine health checks or medical screenings. And very often, as I said, because this condition is associated with a metabolic component, we may see patients with elevated blood sugars or diabetic patients, or some patients who are on the heavy side with obesity. They would have some elevated blood pressure. And then when we check their livers, we check their blood tests, we would pick this abnormalities there, and slowly we will actually try to confirm the condition of the liver, leading to a diagnosis of fatty liver disease. Next slide.
All right.
Yeah.
So, doctor, can you also, other than symptoms, like let's say just now you said about people with diabetes that you take care more of. So, what are the other diagnostic criteria that you, as a doctor, will look out for, and what are the biochemical markers that that we need to look out for NAFLD?
Sure. So of course, as the name means, fatty liver. So we need to make sure that there's actually fatty liver, fat in the liver. So we will need to actually demonstrate the presence of fatty liver, and very often, which is non-invasive imaging by a normal ultrasound of the tummy, which will actually include the liver. Sometimes some patients undergo a CAT scan or a CT scan or an MRI for another part of the body, and incidentally found that there's a lot of fat in the liver. There are other special tests to actually look for or measure the amount of fat in the liver, which is non-invasive, what we call as a fibroscan or even a liver fast test. And of course, when we see these patients, we will actually need to talk to them. We will need to take a good history, especially for alcohol consumption. Because when there is a significant alcohol consumption in such patients, the patients can have the amount or similar amount of fat inside the liver. And sometimes even when we actually take a tissue from the liver to actually look under the microscope, we cannot tell. So it's actually histologically identical to non-alcoholic fatty liver disease. So we need to make sure that the patient does not have any significant alcohol consumption. There are other causes of excessive fat in the liver. Certain patients may be taking steroids. You'll be surprised, we'll see a lot of patients who have gone to the Singse, to the traditional healers, who actually take a lot of over-the-counter steroids, which they do not know. And some of these patients, they have typical steroid overload appearances. And these are the patients who actually have a lot of fat in the liver. Certain medications for cardiac or heart abnormal rhythms like amiodarone, or maybe even certain breast cancer medications or other medicines can also cause fat accumulation in the liver. And we need to make sure the absence of other causes of liver diseases. It could be drug-induced. Certain drugs may actually damage or injure the liver. Viral hepatitis or viruses, especially hepatitis B, hepatitis C, which actually can cause damage to the liver. Other liver problems like biliary cirrhosis, autoimmune problems. So we'll try to actually rule out a lot of things. So in a way, there will be some conditions that we need to rule out before we can tell the patient, yes, you have just plain old fatty liver disease. So there are some of these diagnostic criteria, but again, most commonly it will be some abnormal blood tests and some demonstration of fat in the liver, usually by an ultrasound, commonly by an ultrasound. So aside from the imaging, then we'll move on to blood testing, or what we call as biochemical markers. Very often, patients with some active inflammation, there would be abnormalities in the liver profile tests, which are commonly, we would be looking at AST and ALTs. They may be elevated 2 to 3 times the upper limit of normal. Of course, if it's elevated in 5, 10 times, we would be thinking of other problems. There may be a pattern to how much elevation, which is more elevated than the other. Commonly, we will see this condition, a time where AST is higher than the ALT. There may be some other tests such as the gamma GT, GGT, or even the alkaline phosphatase that can be raised. Most of the time, the marker of bilirubin, which is sometimes what we call as the yellowness or the jaundice marker, it should not be raised unless in patients with advanced liver problems. And then these are the patients that we need to make sure that the patients do not have any blockage of the bile ducts or what we call as obstructive causes, or even advanced problems such as the liver cancer. So these are some of the markers that we will look at. But if very abnormal, we will actually need to be very, very careful. Are we dealing with complications from liver problems?
All right. Thank you, doctor, for the explanation, especially on the biochemical markers, because in pharmacies, in my setting, also a lot of customer, a lot of patients come in with reports, their liver, the AST, ALT is elevated, but they don't know what to do. So we need to make sure it's about 2 to 3 fold higher than the normal range. Then only we will have to look into it, be more careful about it, right? Yeah. So, all right. So, thank you, doctor, for the explanation. So let's, doctor, rest for a while. And this is a time for audience to start ready your fingers. And this is the time for our most exciting giveaway time. All right. So be prepared, your finger around your keyboard, around your phones. All right. So the question for today giveaway time is, what is the full term of NAFLD that we have already mentioned a few times? Doctor and I have already mentioned a few times. What is the full term for NAFLD? So comment your answer below in the comment section, and 3 lucky audiences will be winning away our Caring cash voucher worth 50 ringgit each. And do remember to like and share our Caring Facebook page. Like and share this live stream. Share to your friends and family. Tag 3 of your friends and family with your answer in the comment section below, and you will be one of our lucky winners. All right. So I see a lot of people commenting, but make sure that you also tag your friends and family together to increase your chance of winning. All right. So that they can also learn from doctor about fatty liver tonight. Okay. Yep.
So, Shun Ern, can you use the voucher to buy chocolates and sweets?
Chocolate and sweets can, but be more healthier. Be more healthier. We try to avoid customer to buy sweet and chocolate, right? But maybe a little bit is fine, right, doctor? A little bit is fine, yeah. All right. Cheat day, yeah. Maybe once a week or even once a month, cheat day, right? So, doctor, all right. So everyone is very exciting about this. Okay, so let's continue from where we left off just now. Dr. Chan, if someone is really diagnosed, or unfortunately is diagnosed with NAFLD with all the symptoms and also the biochemical markers, the AST, ALT shoot up very high, as you mentioned just now, what is the best treatment for them?
Okay, so again, this is a metabolic problem, all right? So there are many metabolic factors which actually contribute to this condition. And I always tell my patients, medicine is not the first, second, or even third choice of treatment. Number 1 is weight loss. Number 2, more weight loss. And number 3, also keep going. You need to bring the weight loss down. So 10% is actually the magic number, which is the 10% reduction from their baseline weight to try to reverse the amount of fat in the liver and hopefully reverse the scarring, if at all there are. They have to look into their own lifestyle. Are they taking excessive alcohol? Usually no, because these are the group which are non-alcoholic fatty liver diseases. But they may be actually taking excessive calories, unhealthy foods. They need to make sure that if they have any other comorbid problems like diabetes, other cardiovascular diseases, high blood pressure, heart disease, they have to make sure that their diabetic control is good. They have to make sure the cholesterol is managed properly. They have to have a normal blood pressure, if possible. Then only we will consider, yes, we will need or we can try some medications to try to help in this condition. But again, we have to remind them medicine is not the for it all. They cannot just take medicine and carry on with their wayward lifestyle. They have to lose weight, diet, exercise. In some patients who are obese, morbidly obese usually, we may even consider advising some of them to actually see a special surgeon or a bariatric surgeon where they can actually possibly do some surgical reduction of the size of the stomach to actually increase and help to reverse NAFLD. So in our Malaysian population, when you tell them got the disease, of course, the first thing they will say, doctor, what can I not eat? And number two, why no medicine? But they always forget that, yes, you have to lose weight, diet, control that. And they ask, doctor, what can I eat? So, we have to slowly educate them. But of course, it's a very holistic management where what they do will determine the outcome of their disease. So why do we say that, it's always 10% weight loss? Because in a lot of the studies, those patients, especially in the blue line with circled there, who have lost 10 or more percentage of their weight, there is actually improvement in the hepatitis, there's improvement in the fibrosis or scarring, and with significant weight loss, especially proper lifestyle intervention, it is the mainstay of treatment as well as reversal of their fatty liver disease. Next slide. So that's the main thing. So nothing that, what can I eat? You have to not eat a lot of things. You have to cut down on your calories. You have to bring down your weight. That is the most important thing. And exercise. No shortcut, unfortunately. So a lot of people don't like to see me because I tell them that you cannot eat. You have to work out. You have to bring your weight down.
Yeah, but as a Malaysian, to be honest, I have to confess, it's very difficult to control what you cannot eat. All right, it's too many. It's too many. How to say? I mean, too many foods, too many delicious food around us as a Malaysian.
Too many festivals.
Yes. After like now, after Christmas, you eat your Christmas feast. Then Happy New Year, you got a New Year countdown. Then see what is coming for the bakwa.
Cannot.
So
very, very difficult. Yes.
Yeah, I understand it's very difficult, but with doctor and pharmacist help, I think we can help our patient and our customer to control very good, very well. So so I think after this, a lot of our audiences will go and sign up our gym to do exercise already, right?
New Year resolutions, but not
New Year resolution. Don't go halfway. Don't until June, then the gym no more. That is what we worry of. All right. So, doctor, if let's say customer really follow instruction, really control their diet and go to exercise regularly, like very good, very disciplined. But is there really no other medication that really can help them sideways or a little bit? Is there any recommended medication for these kind of patients?
Of course, as I said, medications are not the first line, not even the second line, third line. There is a role of medications, but usually a little bit at the back side of things in a way, so it is at the background. So there are medications which are actually helping to sort of like stop or even reverse some of this liver damage due to fat in the liver. So for some of the patients, diabetics, and you'll be surprised, up to 80% of diabetics would have fatty liver disease. And there are specific medications which have been shown to actually reverse the scarring or fibrosis in the liver, such as these molecules called pioglitazone, or even what we call as a GLP-1 inhibitors. So these are some of these medicines. If there are diabetic patients, and there may be an option that we can adjust some of these medications to try to help control the diabetes better and also help with their fatty liver disease. In certain patients, we do give patients a higher dose of vitamin E at 800 milligrams per day There's some evidence to help with this fat in the liver. Statins, again, nothing directly reducing the fat in the liver, but of course, it is very important in managing the other comorbid, other medical problems, especially for patients who are diabetics who need to bring down their cholesterol to a very controlled and healthier level. Some people will say, "Oh, doctor, I'm taking this omega-3. Is someone said, it's good for this, good and that." But unfortunately, it does not have a very, very strong evidence. In fact, it's actually weak in terms of actually reducing or improving fatty liver disease. There are medications such as this adenomethionine, what we in short sometimes we call it as SAMe, which has been shown to actually help and aid in this treatment of fatty liver diseases. So yes, there are some medications, but it is nothing. Unfortunately, it's not as easy as a blood pressure medicine where you take a pill, your blood pressure comes down. So these medicine, yes, they do help in a way to help with this fatty liver disease, but it is not the first choice, second choice, third choice fatty liver disease. It is on the lower end. It helps with the liver, but it is not the mainstay of treatment. So patients have to understand they are what they eat. They don't eat properly. They don't lose their weight. It is not going to improve.
Yeah. So again and again, there is no shortcut, yeah, doctor, for this fatty liver problem. No shortcut.
Painful
Yeah.
cut. Painful.
Painful cut. Cut your food, especially is the most painful cut.
Correct.
Yeah. So as we mentioned just now, all the fibrosis, cirrhosis, but at least if we detect it earlier, still is reversible for this fatty liver problem. And then all those elevated biochemical markers. All right. So it's kind of I worry that we are kind of worried out our audiences here. But Dr. Chan, can you share do you have any case study of successful NAFLD patient who were able to reverse this disease?
Of course, I mean, I know for patients who are motivated, they come in early enough. And fortunately, a lot of them are picked up relatively early. They are in a younger age group, in their 20s till their 40s. And for some who are lucky enough to be motivated to get proper treatment as well as lose weight, we have seen successful patients who have reversed their liver fat as well as liver scarring. Okay, maybe I can share a slide. So, one common person, we call him Mr. Simon. He is a 45-year-old executive. Unfortunately, life being not very great genes, he's having diabetes, he's got high blood pressure for 3 years. And during one of these company screening packages, a lot of executives have this. They found to have some abnormal liver enzymes. And during the ultrasound, they note that, oh yes, fatty liver with some gallstones. And when we actually check his blood sugar profile, which is an HbA1c, which is an average 3-month blood sugar profile of 8.5%, which is actually very high. Normally, if for a diabetic who is young without any complications, we want them to be strict, have very good strict control. And our aim is actually to have an average blood sugar of 6.5% and below without any symptoms. Okay, so definitely we can see he's got poorly controlled diabetes. Blood pressure is good, 130/70. And, of course, when we talk to the patients, when we ask and inquire about their alcohol consumption, fortunately, he doesn't really take very much alcohol, occasional yamsing here and there, but nothing significant, which is just social. Okay. When we measure his weight and height, he's 82 kilos, and for his height of 175 centimeters, his body mass index is 26, which is on the overweight side. Of course, when we ask him, he's on the overweight side, yes, he feels a bit tired easily. And when we actually progress further to do this special liver stiffness scan, or sometimes what we call as a fibro scan, there is this result of a CAP, which is 330. Okay, so again, as a ballpark figure, we'll tell our patients, if you have 290, your reading is 290 and above, you have a lot of fat in the liver. So definitely for him, he's got a lot of fat in the liver, 330. And on the other reading called the fibrosis score, a score less than 7 is normal. So for him, there is some early scarring of fibrosis with a fibrosis reading of 7.8. So we've identified a few problems. Definitely he's got fatty liver. There's some evidence of early scarring with a higher fibrosis score than normal. He is definitely overweight, and he can do better with his diabetic control. So what do we do for him? Next slide. So, of course, the main issues, as I've highlighted, he can do better with his diabetic control. Very often patients will tell me, doctor, oh no, my diabetic control is okay, my sugar is, maybe 8 in the morning, but it can be better. It has to be much better. And we try to aim for an average blood sugar of 6.5% on HbA1c, magic number 6.5%. We know he's overweight. He's got a BMI of 26.7. We will try to bring down his weight to a healthier BMI below 23. For Asians, we need to be below 23 for Asian males. We try to encourage him, try to look through his daily dietary consumption and how we can incorporate more exercise into his daily life. We will try to aim for a low baseline weight. And of course, everybody say, hey, doctor, I'm very busy. My boss asked me to work overtime and this and that. So we try to encourage them, maybe they park slightly further away from their office. We try to encourage them to take stairs in the staircase instead of the lift for 2 or 3 stories up. Try to have more exercise, incorporate more exercise in the daily activities. And all this actually help. Okay, so of course, we have done further evaluation of the severity of his fatty liver with this liver elastography, which is what we call as a fibro scan or something like a fibro touch, which is just a scan over the liver area, and that is non-invasive. So no poking with a needle. So patients are generally quite comfortable. And with that, we can tell the patients objectively how much fat is there in the liver and is there any early liver damage. So very often patients say, hey doctor, my ultrasound very normal, but why you tell me I got fat in the liver? General ultrasound is very operator dependent. So maybe the operator A doing the ultrasound will see, maybe I see some fat in the liver. Another operator scanning the same liver will say, no, I don't think there's fat in the liver. So it is very subjective. Whereas with this special scan, there is a documented average measurement, and this is something that we can tell our patients, your liver is so fat, or your liver is not fat. So some patients like that. Everybody wants to be more objective rather than being very subjective. And some patients, after we tell them, yes, you need to diet, exercise, control the other risk factors, and here is a medicine which can help with their efforts to control this fatty liver disease, which is treatment with medications such as adenomethionine, and there are other preparations such as silymarin-based medications, which will also aid and help in the treatment of fatty liver disease. But the mainstay is weight loss, and weight loss. We cannot emphasize enough about weight loss, which is the hardest thing to do.
Yeah, the first three target for this doctor's patient is already weight loss, control, sugar level.
The patients don't like me.
Usually, but we have to work for
We
it.
have to be hard.
We have to be
hard to the patient. We have to be cruel to be kind.
We have to be hard before the liver become hard.
We have to be hard before the liver can soften.
Yeah. All right. So again, as I mentioned just now, and also Dr. keep mentioning, and also in Dr. Chan successful case for this patient is very disciplined, and the first 3 is already like control sugar level, control body weight, all right, your hypertension, control it. So it's very important to get a healthy lifestyle. But as I see just now, Doctor share about the last one, which is a treatment with SAMe. All right, Doctor, can you tell us more about this SAMe? How does it treat our fatty liver?
Okay, so again, it is, as I said, it's not a magic bullet. Okay, it's not that you take the pill, everything disappears, your fat melts away. No.
Again, need to reduce weight.
But of course, we have some additional boosters where this molecule called SAMe or adenomethionine, it actually occurs naturally inside or through all our tissues and fluid in our body. And it is very, very important in many, many metabolic processes, or how where the cells interplay and how it works. And it has actually a big role in the immune system. It helps maintain cell membranes. It can help produce as well as break down brain chemicals such as serotonin, melatonin, and dopamine. You remember when we talked about patients who have a lot of lethargy? So sometimes because of these problems with the fat metabolism as well as imbalance in this sort of molecules of adenomethionine, so patients can have abnormal or imbalance in serotonin, melatonin, disturbing their sleep. So by supplementing this compound, adenomethionine, it actually helps patients in their liver metabolism of fat, in their brain chemicals. So it helps in many, many roles. But it is not the magic bullet. helping and curing is very, very different. So we have to understand that. Okay. So it's a bit complex, but I know it is something, one of these medications that we would try or give patients to help treat these conditions of fatty liver disease. So we would see, because this molecule has so many interplays in the brain, in the body, in the liver, so it helps with their sleep because it regularizes or normalizes melatonin secretion, so patients can sleep better. Because it interplays with this serotonin, patients feel better, and with dopamine, patients' overall well-being is improved. And even with all these improvements throughout, patients respond better to stressful events with improvement in the adrenaline secretion. So a lot of these patients with liver or chronic liver disease, they naturally feel tired, they feel fatigued. So we do have patients who feel very much better after treatment with these medications as part of overall treatment of their liver condition.
All right. Great, doctor. Thank you for the explanation on the SAMe. But again, to let all the audience, doctor also can't emphasize further. Reduce weight, reduce weight, reduce weight. SAMe, yeah, it can help, but at the side way. But for the first thing first, you must
Definitely.
reduce your weight, control your sugar level, your cholesterol, and also your blood pressure. All right. Thank you so much, doctor, for your sharing. But now I think we have some questions from our viewers. All right. So I get an interesting question from Atika. So question, does drinking fruit juice contain fructose every day can cause fatty liver?
Okay, so patients tell me, doctor, is it healthy to drink fruit juice? I make fresh fruit juice. You have turmeric, ginger, carrot, apple, celery. I put everything and I drink 2 cups a day. Doctor, isn't that good? All right. So the simple thing is that things have to be done in moderation. Okay. The problem with drinking fruit juice is that you are just extracting the juice together with some vitamins, a lot of the sugars of fructose, and condensing everything into one glass, which is so easy to drink. Pop in, out, done. The problem is that we are actually removing the not so nice bits, your fiber, your pectin, and things like that from all these fruits. And unfortunately, the amount of fruits, the juice needed to go into a glass of juice, it is for a glass of apple juice, they say you would actually need to to juice 5 to 6 apples just to make one nice glass of juice without adding any water. And in 5 seconds, you finish that. But in contrast, I tell the patient, oh, how many apples do you put, how many oranges do you put in what to make one glass of fruit juice? 5, 6 oranges. But if we would ask you to eat 5 or 6 oranges, it is not easy. And you probably stop at maybe 1 or even 2. So the problem is that fruit juice per se contains a very high amount of fructose or fruit sugars, which in excess, it will also be converted to fat in your body. So generally, I would tell our patients, we'll try to move away from juicing. But if you want, we will encourage to eat a portion or 2 portions of fresh fruits every day, or even a portion of fruits with each meal. So in essence, you might have an apple a day. You try to keep the doctor away, but of course, you eat 10 apples, sugar content is high. You have to be a bit careful. And of course, if you are a diabetic patient or patient with abnormal blood sugars, we will not encourage you to take so much juices, because you would be overloading your body with sugar, even from fructose, which is supposed to be a healthier sugar compared to refined sugar. But again, once it's gone into the body, it is metabolized into sugar and fat. It is not good. Everything in moderation.
Yeah. Although we always thought that fruits is always good for us, but in
Yeah.
moderation, still very
Fresh
important.
fruits.
Yeah.
Fresh
Yeah.
fruits. Don't
Fresh fruit.
juice it. Don't blend it. Don't refine it.
All right. Thank you, doctor. So another question from Ori Hong. So actually, Dr. Chan, if one being diagnosed with NAFLD years back, but now already blood result already all normal, is this still an issue?
Okay, so very often we would have patients who say, hey, doctor, I've been told I've got fatty liver. My liver tests are all very normal. So we do see that patients' liver enzymes would fluctuate. It can be raised and normalized, raised, normalized, and a normal blood test would not tell us effectively whether you have fatty liver, or even if your liver is unhealthy or not. So normally what we would tell our patients that yes, an ultrasound or any test will have shown fatty liver, unless you have lost significant amount of weight, you have turned your life around to be very, very healthy, and then the liver enzyme normalize, then we would take it with a pinch of salt that, if your weight has remained the same, everything else the same, but your liver enzyme is normal, it may not show actually that your liver has become normal. So we would encourage you to actually do a liver elastography test, something like a fibro scan or a fibro touch, to actually measure the amount of fat in the liver. Then we can see objectively, we want to see whether your liver fat has reduced to a normal level. Okay, so simple blood tests, liver enzyme profiles may not tell us the true picture.
So other than the biochemical markers, we need to really scan through the fibroscan and all this thing to get make sure everything is all right.
Correct. So
Yeah,
what is outside may not be inside, the similar inside.
Yeah, so for this audience may need to go for further checkup, is it, doctor?
Definitely, we would encourage to go to your nearest health provider and encourage them to get a proper check for their fatty liver problems, if any.
So, doctor, another interesting question from Ren Xiu. So, as we mentioned just now, we need to take care of our body weight, but how about waist circumference? Is this the warning sign for the NAFLD?
Right. Of course, waist circumference would actually have sort of like relation to overall body weight, as well as obesity and metabolic diseases. So there are, metabolic diseases or metabolic syndrome has some particular criteria with their waist circumferences, both in males and females. So, I mean, you do not expect someone who has a very small waist circumference to be obese. Generally, they don't. But of course, the bigger your waistline, the bigger your pant size, it may not necessarily be a good sign. So, of course, these have to be taken into consideration with other factors. And even though you may have a normal waist circumference, that may not necessarily tell you that your liver is healthy. So there are also special, what we call as imaging or even MRI studies, which have actually shown patients with even a normal body mass index, normal waist circumference, but internally they have actually a lot of fat built up around their intestines, around the inner organs, as well as inside the liver. So being normal in weight and waist circumferences does not necessarily mean that you do not have fatty liver. So, of course, again, these are diseases where if we pick up early, we can actually treat them early. So it will be good to go and see a doctor, say, you want to check your liver, you want to scan your liver for fatty liver, do specific scans. And if they are picked up early, there are treatment available for this problem. Okay, but if it's late, no, definitely it is not easy to help the liver.
Yeah, so waist circumference, although is one of the it may be one of the factors, but we still need to look at the bigger picture.
Definitely.
Yeah. So, doctor, so just now we already mentioned a lot of things we need to cut, a lot of foods, a lot of nice food in Malaysia we need to cut. But is there any food, all right, that we can consume to protect our liver? This is asked by Josephine. All right, Josephine. So, doctor, can you maybe tell our audience, is there any foods that can help them?
Okay, so I mean, generally, we would tell our patients, overall, not only to the liver, the 3F, fresh foods. Okay, so we'll try to reduce the amount of processed foods. We have to work hard to have freshly prepared foods, fresh fruits, fresh vegetables. Nothing canned. We try to avoid that. So we try to move away from preservatives, preserved foods. Okay. Two will be fiber. Overall, we have to increase our fiber in the diet. It does help our overall gastrointestinal health as well as the liver. I mean, we would encourage a variety of foods, legumes, nuts, healthy oils, some Mediterranean diet as well. Okay, and of course, for overall gut health or intestinal health, some firm such as kimchi, or even what we call as tempeh for some of us who eat, or because all these actually have naturally occurring pre and probiotics, which actually have an overall improvement in our gut health and also to the liver. So I wouldn't go into specifics what you must eat, can you? And the problem is that when someone says, "Oh, these are good for you," people take it in excess. Same like a fruit juice, just because fruits are good, juicing doesn't really make it very much better, and it may actually be detrimental. So a balanced diet, and of course balance with enough exercise, have a healthy weight. Sleep is also something very important to your liver. So enough of after this, no more Facebook sessions, no more scrolling other people's Facebook, what they're doing, enough, have good rest at night, and that is also very important for overall liver health.
But I need to stay with our Facebook Live first.
Short while more.
In a short while more.
Let's see who wins the
So yeah, so doctor, there is an interesting question from Chris Ross. He's actually asking, taking jamu. A lot of our Malaysians is taking jamu can cause of fatty liver.
Okay, so what happened is that unfortunately, jamu it is not always very well regulated compared to pharmaceutical preparations of medicine, which is very strictly regulated. Jamu can have a concoction of many, many different herbs, maybe even spices as such. And trouble is that some jamus may be contaminated with naturally occurring steroids or medications, which when it is unregulated and taken in excess, it may cause problems. Some jamu will have contents containing steroids, and if it's taken in excess or even taken without proper treatment or indication, steroids can cause fatty liver. Okay, so and the only other problem with jamu is that aside from fatty liver, which is not always a main concern, we would be concerned about the other contents or components of jamu, which may cause disease or irritation to the liver, causing liver diseases. So that is something that I'm actually more concerned rather than fatty liver. So question would be, can jamu cause fatty liver? I would say possibly if it contains steroids, but I would be more worried about the other components which can irritate or damage the liver without causing fat in the liver.
Yeah, because there's a lot of unregulated content that we really do know in the jamu.
Yeah.
And usually what we eat, you have to pass through our liver first, right? So if anything that will stay in the liver, that can cause some liver problem.
So very often liver damage from jamu, it doesn't reach the stage of fatty liver, but it actually damages the liver in ways, and not even to the extent of fatty liver yet.
But reduce your liver health already.
Correct.
Yeah. So make sure that you ask your doctor and your pharmacist before you're taking anything into your mouth and go through your liver. All right. So yeah. So doctor, there is another question. So maybe a last two questions. So need doctor to mention again, maybe explain again. So this audience, Andrea Wong, asking, my husband has fatty liver and doctor gave supplement Heptrol. I think doctor just now mentioned about this. Is it good for him?
Yes, as I mentioned earlier on, Heptrol is one of the medications we use to help improve liver health. As we have shown earlier on, Heptrol has many avenues where it helps the body, not only in the liver, but as a treatment modality. Yes, I would agree with the managing doctor that Heptrol is one of the treatment modalities. But of course, very important, we do not depend on Heptrol. We do not just take 2 tablets of Heptrol, 3 tablets of Heptrol a day, and after that carry on with our detrimental lifestyle. They may be smoking, they may be drinking, weight is increasing every time they see the doctor. So, that's why I remind patients, it is not the first mainstay of treatment. It's not like blood pressure where you take a pill, yes, your blood pressure comes down. Heptrol will not make your fat in the liver disappear, but it helps. So treatment-wise, yes, it is one step of treatment, but the first 3 steps of weight loss, diet, exercise has to be emphasized.
Yeah. So Andrea, after this, not only ask your husband to take Heptrol, but you have to ask him to go jogging, go exercise. Maybe we go jogging together with him also. All right. So the last question, doctor, if patient with NAFLD but sadly refuse treatment, how many years will the progress into maybe liver failure or maybe become irreversible? Is it after several years or several months?
So generally, it will take time for fatty liver to go into a lot of inflammation, causing scarring, and ultimately irreversible scarring called liver cirrhosis. And probably the terminal event would be liver failure or liver cancer. Okay, so it might be 10 to 15 years depending. Okay, so there is this numbers what we call as 1, 3, and 5. Okay, so for patients with fatty liver, 1/3 of them may go into the condition of inflammatory disease or NASH or the non-alcoholic steatohepatitis where there's active inflammation. So 1/3 of them would go into it. Okay, out of this 1/3 with this inflammation, 20% or 1/5 of them will go into liver hardening, liver cirrhosis. Okay, so of course, there will be patients with fatty liver, nothing happens to them. But there will be a group of patients who have scarring, and over time, they will develop irreversible liver damage, liver cirrhosis. Okay, so if you know that you've got fatty liver, act on it, work on it. Don't leave it till last minute. When the liver is hardened, cirrhosis irreversibly, the doctors cannot do very much. And even at that time, if you were wanting to bring your weight down, it's not going to help your liver. The liver would have limited regeneration abilities. And once it crosses a certain threshold, unfortunately, it cannot go back. You cannot grow any younger. Your liver cannot grow another liver.
So yeah, thank you, doctor. So Alif, don't take risks. Don't take risks. Go seek for advice, exercise, control your diet. Start from today. All right. So I think it's the end of our sharing session for tonight live stream. Thank you everyone for joining us today. And before we end our session, to the viewers who are joining us halfway, remember to answer the question that we have already pinned in our comment section. What is the full term of NAFLD? Comment it with the right answer, tag 3 of your friends and family, like our Facebook, Caring Pharmacy Facebook page, share this link so that you can stand a chance of winning Caring cash voucher worth 50 ringgit after this session. And we will announce the winner maybe sometime after end of the session. All right. So, doctor, before we end totally of our today exciting live stream our session, do you have any advice before to our audience? All right, before we end this.
Right. So we will tell our patients knowledge is key. You have to know what are your medical problems, if at all. At a certain age, you need to go for some check. Don't just wait until you are ill, unhealthy, and you go for your checks. Sometimes a lot of things are too late. Importantly, you can always start having a healthy lifestyle, see your doctor, have the appropriate checks, blood tests, scans as such. And then if there's a problem, medicine is advancing at a very, very rapid pace every day, every year. A lot of treatment modalities are available. But of course, the most important thing, all treatment starts from you yourself as a patient. The doctor may recommend some medications. If you don't take it, it's not going to help you. The doctor will recommend things that you need to avoid, changing your lifestyle, diet, which is not easy. But unfortunately, that is needed to have a healthier, leaner, and a mind and as well as body. So, look into your own health. You have to take advantage of time on your side, diagnose it early, get it treated properly.
Yeah. So check it earlier, exercise, take care of your diet, be responsible of your own body and also your liver.
Be responsible.
Yeah, be responsible. So at the end, thank you everyone for joining us tonight. I think we have learned a lot from Dr. Chan about our liver health, how to take care of our liver, and what is fatty liver and how we can prevent it and even maybe reverse it. Okay, so thank you, Dr. Chan, for your extensive knowledge sharing with us. So
thank you for having me tonight.
Thank you, Dr. Chan. So as for the viewers, all right, so we still in this live stream, remember to comment the correct answer for the question, tag your friends and family, and be sure to keep an eye on our Caring Pharmacy Facebook page that we will announce the winner of the 3 lucky winners in our Facebook page sometime soon. All right. So once again, thank you everyone for joining us in this lovely Thursday evening, and we'll see you again in the next live stream Facebook live show. Thank you everyone. Good night.
Good night. Thank you very much.
Bye bye.
Take care. Love your liver.